I am Arnab Gua from Impeccable Innovations Private Limited, and we are running a gluten-free brand, Sportify. We are fortunate that we have come to one of our consumers, Dr. Sheela Roy, is resident. She will tell you how Sportify has helped her and her family.
Good morning.
Which are the hospitals or organizations you have earlier worked in your career?
I worked in AIMS for 10 years. Then I worked in Bombay in very good hospitals for 10 years. Then I came back once he retired. Then we came back. He's a retired civil service man. So and then I had some hospitals, but their research work was not that good. I started doing some, but I used to do the clinical practice here in Noida.
Okay.
And I still do that. Whatever few patients they are still sticking to me. I don't know how long I'll be able to do it, but so far so good. No problem. I maintain my IQ and everything.
Which Sportify atta you are taking currently?
Celkey we are taking. It is almost 3 months.
Yeah, almost
3 months. Yeah, 3 months.
How much you are eating per day?
We are eating only once in the night, the atta, the flour. And my husband has improved very much. With little bit of atta only, he has really improved. But I use also the cereal and the sugar which you make, jaggery. And those Palmyra. I use everything for him. So all put together, he is really improving. In 10 days time, I could see the difference in his blood sugar, in his general well-being. And then after 2 weeks, I think after 3 weeks of consuming, we stopped the morning dose of insulin, which he was having for last 15 years, almost sometimes 10, 12, 14 units also. So now that he has got nothing in the morning, only in the night we give him just the 6 units. So that way it is a very good achievement for me. I could get rid of the insulin from him. And otherwise also he is doing good. And only thing now that bothers him is the constipation. For that Arnab has told me what to do, and we'll try that and we'll see how he does. But on the whole, I'm really very happy to have the things, whatever you people are making.
And how is the taste?
Taste-wise, there is no problem. Even the oil also he is not creating any problem. He is very fussy about food. So I was skeptical about the oil, but when he takes the oil, he doesn't say anything. I think he doesn't find any difference.
And you like the Sportify low GI rice, the Sportify
and rice is also good. His quantity has gone down, but he feels very full with a little bit amount of the rice. That's the best thing.
And the taste is almost like any other rice.
Yeah, he doesn't mind, and looks like also the same type. Little bit of thick, and not like basmati, but he doesn't mind. He doesn't mind. So far, he doesn't mind, then I am happy. Otherwise, it becomes very difficult to push him anything which he doesn't like.
That means for months, the person is unconsciously living. Health does not deteriorate in a span of 24 hours. Health deteriorates in a span of at least 1 month. Main problem is leaky gut. And leaky gut is not the only problem for your autistic child, but with age, with any disease, leaky gut is. So as a clinician, what are the main parameters that you look for a diabetic person, that if a food is effective or not? What type of clinical parameters that you look? One is the blood sugar,
blood pressure, and general well-being.
And HbA1c.
That comes in the sugar itself.
Sugar.
Yeah, sugar itself.
And fasting insulin.
Fasting insulin also. So these are the same few parameters which we find that he has improved.
Okay.
And I always advocate this one ever since he has improved. Whatever patients or whoever comes to me, not even the patients, I always encourage them to go for the testing. That's what I wonder. How much they are going back to have it, I don't know. But I am always encouraging because I myself got a very good feeling and effect of the product. Whenever I did practice, I never called anybody. So many people from RWA used to call me and give the advertisement in the booklet. I said, no, I have never advertised myself. And I'll not do that. I've got a
board.
Yeah, outside board.
Yeah.
That's good enough. And people were coming. You ask him how many patients were coming. I used to get tired. Now the patients when come, I really don't feel like eating. I want to relax. I want to have my good time now at the back end of my life.
No, I don't think it's a fag end of my life. Spotify is there for you and for sir.
That's good. My ghee shakkar, I will tell.
We feel that life is so beautiful and so much of work we need to do in this life.
Good service.
Yeah.
As long as I can get service, nothing like it. In COVID time, you don't believe that around you used to get angry. Why do you see that? I was there from Chandigarh, from different places, and they are waiting for my call. How can I not do that? And I have so many 20 severely ill patients, and I feel really happy to tell you, none of them had any problem. They all survived.
Wow.
And they are still taking to me. You ask me how many times they call me in any cough or cold or anything, they will call from Chandigarh. Now they are in Chandigarh, so they will always call.
So on a nutshell, if I summarize everything, that a medical doctor and such an experienced medical doctor like you, Dr. Roy, you vouch for our type of innovation because you have seen it with your own hands and with your own family.
I have seen the positive effects, so I really work for it. And I really push people to take it, especially those who are diabetic. I told their wives that you
Thank you,
will.
ma'am, for giving us such
Thank you
a
for
warm reception. And here, Dr. Sheela Roy, she's our strong supporter.
For sure.
Yeah, and
Absolutely right.
we want more such doctor to support us, support this innovation, because we are building this company for the future generation so that they have nutritious food which can help their gut health. Thank you.